We don't have that now, and we certainly can't be putting those restrictions on the borders of Northborough. So without the other communities around us fully participating and the Commonwealth participating or preventing people from these unmasked jurisdictions coming in and hanging out with us for a while, I'm not sure that it's going to be as effective as we think it's going to be. You know, it worked before because it was a Commonwealth-wide mandate. My third issue with this is the burden that it's going to put on the small businesses in town, because now you're having the small businesses policing the people coming in. And we know what kind of grief these business owners got last time that we had this. And, you know, it took a long time and took a lot of patience for them to kind of get through all that and to get their customers back to a place of happiness. So, you know, while I agree with the idea that masks are helpful, this is a futile endeavor if we can't tell them the type of mask they have to wear and make sure that everybody that comes through this town is from a town that is also wearing masks. And so that our business owners don't also then have to do the enforcement. I mean, the enforcement part of this is going to be a nightmare. So, you know, I'm not against masks. I just seeing this as a mandate as opposed to saying, giving every business owner and everyone else the opportunity to say, if you're coming into my place, you have to wear a mask and this is what's required of you. You know, and just encouraging it as opposed to mandating it. So that's where I fall on this. And I might be wrong on some of the science part because I'm a lawyer, not a doctor. So, you know, I tried really hard to read both sides of the science and the articles and everything. So, you know, and not just take a biased approach to it. Because honestly, I don't have an opinion one way or the other on whether it's good, bad, or indifferent. But before we start to throw mandates at people, I mean, we left England because we didn't want all that. And I feel like we're going back there. So I'm done now. I'll stop ranting.
Okay.
Just 1 minute, Mr. Chair.
Yes.
We are now live streaming, and I'm sorry for those technical difficulties. So and I'm texting with our town, technology here. So just to make it official that we wouldn't have to redo the meeting, if we could do a quick roll call again.
Okay.
And I will do a hyper speed script.
Okay.
And we can be official. So just to members of the public, I apologize if you're seeing this via live stream and it didn't start on time. No votes have been taken, but just for the sake of the record and meeting open meeting law, if we could just quickly, maybe start with a roll call and
Okay.
and I'll read the script again and then we should be okay. So sorry to interrupt there, Teresa. I don't want to make y'all come back tomorrow morning to make this official.
Thank you very
any
much.
actions to be taken. Thank you.
Okay, this is January 6th, 2022, meeting of the Board of Health for the town of Northborough. We're going to take a roll call of the members of the board. Lisa.
Present.
Sawati.
Present.
Dilip.
Present.
Teresa.
Present.
And I'm Glenn French, chairman of the board. We have Kristen Black as our health agent. Also, Isabel? Isabel?
Yeah.
Hello. And with that, we'll turn it back over to Kristen Black, who's going to read us a little blurb on the Chapter 20 of the Acts of 2021.
Thank you, Mr. Chair. So again, this open meeting of the Northborough Board of Health is being conducted remotely consistent with Governor Baker's executive order of June 16, 2021, an act relative to extending certain COVID-19 measures adopted during the state of emergency. All members of the Northborough Board of Health are allowed and encouraged to participate remotely. The order allows the Northborough Board of Health to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. The public is encouraged to follow along using the posted agenda unless the chair notes otherwise. Members of the public who wish to view the live stream of this meeting may do so by going to Northborough Remote Meetings on YouTube via the link listed on the agenda. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting will not feature public comment. Thank you, Mr. Chair.
Very good. Okay, let's see. Lisa, do you have anything further you would like to add regarding
I am
discussion
in
on
favor. Yes, I am in favor of the mandate. I think it sets precedents, particularly for the establishments in the town where we have workers of all ages, teenagers, young adults, older adults, and they're uncomfortable wearing a mask if it's not a mandate, but they'd rather wear a mask. There's this struggle of, well, should I? If it was enforced, I would. Teresa brings up a really good point that, we want to allow people that flexibility, but the education alone is not working. People are aware they should be wearing masks. The education's everywhere. People have COVID fatigue. So, for all those reasons, I think that people need to be reminded it's important. Until we have something else, we need to at least wear a mask. Now, the CDC does recommend the KN95s and N95s or the surgical mask, but they have also said any mask is better than no mask. So while it might not be a perfect alignment of everything we need to prevent the spread, it certainly is better than nothing. And I think a lot of people do have KN95s now or surgical masks. I mean, we have the blend of the dirty old masks that you see people wearing. But, I think that a mask period is better than no mask. And again, it's setting precedents for the importance of we're in a pandemic and we still need to treat ourselves as if we are social distancing, wear a mask, it's a piece of it. There's no
Right.
ideal, unless we're going to stay home.
Right. Okay, thank you.
Yeah,
Thank you.
yeah. Glenn, I had sent in a link to the CDC website regarding the different types of masks that they're recommending and what is not being recommended. I sent it on the email thread. And again, to Teresa and Lisa's point, multi-layer mask, even if it's a cloth mask, is better. And they are available on the market, Amazon, wherever you want to go, they're available everywhere. So even if it's a cloth mask, that's fine. Single-use masks are meant just for that, single use. And of course, they're recommending the KN95s, and they're available everywhere now. So it's not like people don't have access to getting those. So I really think that that's the issue, that there are different masks out there, but people have to be smart about what they're going to use.
Right. Too bad we couldn't get a bunch of masks and get them to different businesses. Like at my office, we've got a bowl of masks there in case somebody doesn't have one.
Yeah, so
They
instead
wanna
of
come in.
instead of handing out pens and
Right.
chapsticks, maybe they should have personalized KN95 masks.
Okay.
Attorney Glenn French with your telephone number and address on there.
I got my pen. I got
Well,
about 6 masks.
Don't do the pens because now you have to sterilize the pens too when somebody uses them. So you might as well give them a mask.
No, I'm just gonna write it on. I got a Sharpie. All right, well, does anyone else have, any other members of the board have anything to add? Nope. Okay. Then I suggest the chair will entertain a motion for a temporary mask mandate. I think it should be temporary going from meeting to meeting in the town of Northborough. Delete?
Yeah, I motion that the town of Northborough's Board of Health approve a temporary mask mandate for all indoor purposes. I think that's what the
Yeah.
thing, right? For all indoor purposes and establishments, and to be decided on a month-to-month basis at our Board of Health meeting as to how long to keep it extended for.
And that would be this, Kristen, we've got this document that's been circulated to the board. That's what we're all talking about. It's got a name to it.
So what I could do, if you'd like, I could share that screen. I don't know if we want to do a motion in a second, open to discussion, make any edits. We can live make edits on the screens if there's a preference or however you would like to proceed. But I could I share
what's
the screen and I know we have to, there's the draft that was sent that was prepared with input from town council from earlier version they drafted over a year ago prior to the governor passing the statewide mandate. And also I believe they took into account or took a look at the mandates that were forwarded to them from Grafton and Westboro as well. So I can go ahead and share that. I know it does not include a date, so if it's something the board would vote to move forward with, we would want to consider effective date. I would recommend no sooner than Monday. Tomorrow is a snow day, a half day. We need to get words to businesses if changes were to take place.
Okay. So let's see, we need someone to second the motion that it would begin. Delete, we're gonna have you amend your motion a bit
Okay,
and add in that the starting date would be Monday, 12:01 a.m. Which
Okay.
is, what's the date on Monday?
January 10th.
The 10th. And what else do we need to do with this? I think that's it. So we need someone to second it.
I believe,
Sawati,
and I also believe there was one comment from a board member about redundancy in restaurants I believe pop up. So I don't know if we want to go over those edits now or to work our way through the document. Someone wants to take a read over it so the public could hear the language. It's not a killer. It is a 2-page document. Would you like me to read through it?
yes, please.
Okay. So the title of this document is COVID-19 Public Health Emergency Regulation. Notice is hereby given on January 6, 2022, that the Northborough Board of Health adopted the following emergency regulations under the provisions of Mass General Law, Chapter 111, Section 31, 104, and 122, based on review of the current COVID-19 caseload and testing positivity rates in the community and the rise of the Omicron variant. The Board of Health has found that there exists in the community a disease and cause of sickness that is dangerous to public health, and that action is necessary to minimize the further spread of the disease. The following indoor face covering regulations have been adopted as a public health mandate in the order in the town of Northborough. So effective at 12:01 a.m. on Monday, January 10th, 2022. Face coverings that cover the nose and face. I think it should say the nose and mouth, not the nose and
Mhm.
mouth, are required for all individuals, regardless of vaccination status, age 2 years and above, in all indoor public spaces, including but not limited to restaurants, retail establishments, restaurants again, that was the duplicate. Thank you, thorough readers. Bars, performance venues, social clubs, event spaces, healthcare facilities, and congregate care settings, places of religious worship, and municipal buildings and private spaces open to the public. The face covering shall be a face mask, such as a surgical mask, N95 respirator, or cloth mask, or some other form of suitable covering over the nose and mouth. Single layer cloth masks alone are the least effective and should be avoided. Notwithstanding any provisions of this regulation, an order face covering should not be placed on young children under 2 years old, anyone who has trouble breathing, anyone who is unconscious, incapacitated, or otherwise unable to remove the face covering without assistance, or anyone who due to a disability is unable to wear a face covering. Food service establishment customers may only remove face coverings when seated and consuming food and beverages. Indoor performance venue customers may only remove face coverings in the actual act of eating and drinking if permitted in the venue. Lodging guests and workers are required to wear face coverings when inside hallways and common areas. Residents and employees of multifamily dwelling units are required to wear face coverings inside hallways and other common areas. Notice of this requirement shall be posted at all entry doors to the building and common areas. Fitness centers, health club workers, customers, and visitors are required to wear face coverings during fitness activity, including strenuous activity and group activity. At personal service establishments, including but not limited to barbershops, hair and nail salons, and massage establishments, all customers and workers are required to wear face coverings except for skin or beard care that occurs on the face, where the customers may temporarily remove the face covering but must immediately put the face covering back on for the remainder of the visit. Face coverings are required in public and private transportation systems, including ride shares, deliveries, taxis. We're going to remove ferries because we have none of those in Northborough that I know of, and buses. Nothing in this regulation shall affect the state and federal orders already in effect in Massachusetts and mandates established by the Commissioner of the Department of Department of Elementary and Secondary Education regarding the wearing of face coverings in schools. Businesses open to the public must post notice on their entry doors advising customers that face coverings must be worn inside the establishment. Establishment staff must supervise and enforce this requirement. If a customer refuses to wear a face covering for non-medical reasons, a business may decline entry to the individual. The Board of Health and its authorized agents pursuant to Mass General Law, Chapter 111, Section 30, are authorized to enforce this order, and if necessary, may do so with the assistance of the Northborough Police Department in the sole discretion of the Chief of Police. Whoever violates any provision of this regulation and order may be penalized by a non-criminal disposition process as provided in Massachusetts General Laws, Chapter 40, Section 21D. In the town's non-criminal disposition bylaw, section 104-020 of the Northborough Code. If non-criminal disposition is elected, then a person who violates any provision of this regulation and order shall be subject to, for a first offense, fine, a written warning; for a second offense, fine, a penalty in the amount of $100; for a third offense, a penalty of $200; and for a fourth or subsequent offense, a penalty in the amount of $300. Each day or portion thereof in which there is a violation shall constitute a separate offense. If more than one, each condition violated shall constitute a separate offense. Notwithstanding the foregoing, agents and officers are encouraged to educate offenders and exercise their judgment on a case-by-case basis, and they may issue verbal or written warnings prior to determining that offense has occurred. This regulation and order shall remain in effect until rescinded by the Board of Health. And then it just has your signature lines that will need to be added later.
I've got a legal question on this. Teresa, if I'm not wearing a mask and I go into an establishment and the clerk working at the establishment says, you can't come in here, you need a mask, right? And I say, okay, well, I'm not wearing a mask and I'm coming in. And they say, well, you can't come in here, you're required to wear a mask. Am I then trespassing?
I don't think that you can trespass in a public place. So if it's open to the public, it's open to you unless there's a formal restraining order in place against you, is my understanding. So they would have to actually call the police and have you removed by the police, which again goes to the problem of putting enforcement on small businesses.
Yeah. I gotta.
It's gonna tax all the systems.
Hopefully the good citizens of Northborough and those coming to visit our fine town will understand the importance of wearing a mask and respect the employees and the owners of these shops and restaurants who are now required to tell them to wear a mask.
A question, Chris, and maybe you have the answer, maybe not. When we did have the mask mandates in last year, did we have any issues with enforcing it with the local businesses, and how many times were the police involved in that?
Rarely. I can't remember an instance where we had the police, where we actually enforced it. There were no fines issued. I do know numerous times, just based on the limitations of our health department staff, we did ask for the police department to visit certain establishments where we were getting frequent complaints, and they were to visit. I think they were, generally well received, and we didn't have any problem establishments, or, I think the hardest thing last time around, and what I've heard from other communities, is it's really the indoor gyms are like because people are used to exercising. We want to move the equipment. It's very hard. So I feel like the gyms in town, it was the hardest. And a lot of the gym owners would say, nobody wants to work out with a mask on, running on our machines. And, that was, I think, the hardest. And the most calls were probably surrounding, not anyone in particular, but just gyms in general.
That makes sense.
Well, I mean, isn't there an opportunity to carve out gyms and require the gym owners to make sure that their participants are testing negative before they participate?
I think if we start carving out one business from another business, it's a fine line between all businesses saying, listen, no one
I
wants to
think
come
it's
to
the honor
mind.
system. It's the honor system. It even is, I mean, I'm in dental and we ask people if they're vaccinated and we just have to take it at face value. There's nothing saying we have to know, they can show us a card, they could make up a card. There's that,
Right.
There's that piece that you don't know. Now, we don't have the resources or the capacity to do anything other than what we're doing here, which I think is really helpful. But it's the tone, it's the message of we're really trying to protect our community. Please wear a mask. We're not looking to have you arrested. We're not looking to call the police. And I would hope some of the businesses might have to, look the other way if someone's coming in and they're going to barge their way in and not wear a mask. I mean, it depends on how they want to manage it.
I think it raises, to that point, Lisa, I think it raises the public awareness all around us that, wear your mask, wash your hands, keep your distance. It's back on.
Mhm.
Game on again.
Yeah.
And that's really what's going on here. Anybody else? I need somebody to second the motion if there's no comments and no public comments.
I did have a question. Kristen, I don't remember. Was there a 6-foot distance requirement that's being imposed again on that, or is it just masking?
No, this is just masking. And so I have seen other orders that have included 6-foot distancing. But the way that I can recollect and just reading it there, this does not have any requirement for hand washing, social distancing, or other measures, masking solely. But just a note, back to Mr. Chair, we may want to do a second just to officially enter the discussion. So I know we had, did Delete make the motion?
Well, I'm going to second it.
Okay.
Okay, well, if there's no public comments and there's no further comments from the board, I guess we're going to take a vote. Let's see. Lisa, in favor?
Yes, in favor.
Swati, in
I'm
favor?
very much in favor.
Delete?
In favor.
Teresa?
Opposed?
And Glenn, in favor. The motion passes and begins Monday at 12:01. That's it. Do we want to we got the COVID updates? Is there any other business coming to the board?
No, we can, yep. Mr. Chair, you're sitting with the agenda straight in front of you, just because it looks like you have
I
it there.
am.
If you could just
Yep.
give me the
I'm
individual line
flipping
items,
pages.
I don't have it
Feverishly.
printed. So we'll take you through that.
So
I
you
think
got,
first item is vaccination.
Let's see, COVID update, vaccine clinics and eligibility.
Okay, so if you're following the news, you may have heard that the boosters are now approved, both CDC, FDA authorized CDC, blessed it with the director's sign off. I'm not sure if DPH completely officially voted, but color registration is now open, and that means I can move into the next phases of actually opening registrations to families. I know they're very anxious. What was interesting, and remind me, Swati and Dilip, I believe in a quick read of it, it's not 6 months, it's just 5 months in between from the second dose. All of us that have received boosters so far, if we're not in the immunocompromised category, we're always waiting for that 6-month mark. And they've sped that up a little in this age group of ages 12 and older. So again, the Pfizer approval. So I've been working with towns of Southborough and Boylston as part of the Greater Boroughs Partnership, talking with the schools, their senior center, and other town staff. And we are looking to do our first clinic on Tuesday of next week. And we're going to hold 3 clinics over the next 3 weeks, doing about 350 doses of Pfizer, focusing on 12 and up. But if anyone has a parent would like to register, it's all the same formula. It's all the same dose, booster, first dose, second dose. Pfizer, I believe it's all the 0.3. And so we'll be opening that up to the community, circulating it through the schools, posting it on the town's webpage. And so hopefully we'll be able to fit the demand, which is what we've done all along. We sell out one clinic and we book another. So Will be request for volunteer vaccinators are MRC, police, the fire departments and their staff, our contracted nursing and other public health staff have all received a sign up form. We'll hope to have those staff, and I'll be focusing tomorrow on getting those posted. So excited to move into that next category because, as a lot of you know, the quarantine guidelines have changed. If outside of school, so if you don't have that booster and you're over 6 months, like my 13-year-old, if he is exposed, he does have to quarantine because he's not boosted. So for a lot of people, they've been very anxious to just get this because of the quarantine change. So
Right.
we look forward to that. Other update on the vaccination clinics. We did have a clinic plan for tomorrow, both Pfizer and Moderna at the Northborough Senior Center. That was, we had all of the appointments, 250 booked. We did have to cancel due to the storm. And so we are rescheduling. Everybody is going to receive an invite to reschedule for the following Friday. So we'll be able to keep those appointments open. The great news is on all these clinics, we did quickly receive all the vaccine that was requested. Working with Southborough, we'll have over 1,200 doses of the new formula Pfizer to be able to accommodate those clinics. So lots more clinics, and we thank you to the Northborough Senior Center. It's a beautiful location. We have an office set up there, and it's really been efficient. System to keep everything. And so next items, I don't know if there are any other questions on vaccination clinics.
Did you say 250 appointments scheduled for tomorrow?
Yes. Yep. 250.
So still like a ton of people who aren't even first or second vaccinated.
Or those were all booster.
Oh,
All
those are all
boosters, a lot,
Okay,
everyone.
all right,
And a
I'm
lot,
sorry.
we're working through, it's not our seniors as much now. It's more of our, parents and,
Yeah.
middle age and working down the line, college students who are home. We're still getting through some of the, 16 and 17-year-olds as well. So it's a real mix across all age categories, 16 and up.
Okay.
Christine, where are the other clinics? The 3 other clinics that you mentioned, 12 and above boosters?
Yeah, we're going to do them all at the Northborough Senior
Okay.
Center. And so
Oh,
we're
okay.
partnering with Southborough. So you won't see a clinic in Southborough or a clinic in Boylston. We're going to try to bring people here. I mean, the schools in Boylston, for example, may choose to do their own small clinic. But we are definitely partnering with the other communities and making this available. We're doing the hours of 5 to 8 p.m. So all of those students, can hopefully make their basketball practice and then get over there or dinner and, trying to make it as convenient as possible for families so they're not missing school.
Nice.
Okay. Contact tracing.
Okay. So thank goodness we have received so many grants over the last year. That has allowed us as a region of the greater boroughs to hire additional staff. So as you know, we have Erin Shanahan, who works mostly out of Northborough, but she's providing services. She's our RN on staff, as well as a Jim Frederick, who is doing office hours. And he's an RN as well, doing 24 hours total, but 15 in office hours working with Westborough. They have been out flat. You can imagine you can't make any 87 phone calls in one community in a day. So we did receive that second contact tracing grant where Sam and VNA brought on 2 additional staff at 24 hours each, Heather Stratton and Penny Giacobi. And so they are fully on board. And the lovely Isabella Caruso, who now is our epidemiologist for the region, who will also be coming in to assist. And so Isabella, I feel so fortunate that our region found Isabella. I think I couldn't have invented a better candidate, and she interviewed so well, and she's a pleasure, and her references were glowing. But Isabella, we'd love to if you could just give the board just an update about, where you are and your path in epidemiology, talk about your degrees to date and your experience with contact tracing. Would be great.
Of course. Well, thank you so much. It's a pleasure. So my name is Isabella. Last year I got my MPH at UMass Amherst, and I am now in my first year of my PhD in epidemiology. So I'm definitely continuing my education, working with Kristen. I have been a contact tracer since the very first of the pandemic. So I worked with UMass Amherst a lot, and then the town of Needham, continuing to do contact tracing for them. So I've really seen the day-to-day phone calls, also now working on trends, data visualization, and all of that. So I'm really excited to, continue working with COVID and just hopefully seeing this out. But thank you.
Thank you. Welcome.
Welcome. It's great to have you.
So
What
thanks
is-
to Isabella and the state, Isabella already has access to Maven, which many towns have struggled for weeks and weeks to get everybody on board. So with our two new part-time nurses and Isabella, and I'm working with Sam and VNA, who may be trying to bring on an additional per diem nurse, really to have as robust as possible. I mean, our goal is to make contact with every single case, right? That's what all local boards of health are supposed to do. Unprecedented times, and it's not really attainable during some of these surges. So we're really trying to focus our efforts. We're doing pretty well in getting through those cases. The schools are phenomenal, and the nurses are continuing to support contact tracing in those age groups. But we're ramped up, and we're continuing to ramp up. And Isabel will be here as well, and focusing mostly, I think, on clusters, daycares, higher risk settings, like long-term care settings in the 4 towns, and really trying to make her focus more around those specialty groups where the nurses are doing more case-to-case management. But we'll see how it goes. Isabella's been working hard, and one thing we talked about is data visualization. People always say to the Board of Health, well, how many cases this week? And the state, changed their reporting system, and it's really hard to drill down to see what are Northborough's case rates. So with Isabella on board, she's working hard on like a 2-page dashboard PDF document that will hopefully be released maybe starting as soon as next Friday, that we can release it Friday so the community can really take a look. And how do we weigh up to Westboro, and where are the cases? Are they going up? Are they going down? Where's their percent positivity? And also how it relates to the state. And so we're working on that, and I will circulate it to the board if you want to independently, provide feedback to Isabella, as she's, figuring out what boxes and what data is meaningful. But, there is a lot of work to do. So we're trying to make it manageable and not a all day 8-hour data report, but more something that, with pivot tables and all the rest, Isabella can help. But we have a lot of questions. We have seniors and parents and other people that just, want to know where are we now, and I don't want to dig through that state's dashboard. So hopefully that will be coming soon to the community, and say for Isabel to help us with that.
Is this for the whole consortium? Or yes?
I wish we
Westboro?
had her all to herself, but we
Yeah,
are going to share her. So Isabella will be supporting the 4 communities, mostly remotely. We do want to bring her in and let her see sort of the full public health experience of maybe visiting with some of the clinics and some of the testing and other things we're doing. But for the most part, supporting across the 4 in a mostly remotely capacity, as she is still attending school. So this is a 19-hour-a-week position.
Great. Which segues right into testing.
Testing. So I think it's such a hot topic for so many people. I think everybody knows of someone that's, ran off to a local pharmacy because they heard on social media they may have some kits, or a friend called, or I had this great story about a individual in another town that just spends her free time scooping them up and delivering them to people she knows that really are in need in her community. So testing is limited across the country. I know there was a recent bid that went out with the state where they're trying to use the state bid process to allow municipalities to independently purchase, individual test kits. Originally, when that bid process went out, the state was under the assumption that we could possibly use FEMA or federal funds to buy those individual test kits. We've heard that that is not the case. So there is possibly the ability of ARPA funds. The test kits in this bid process did come back at somewhere between $5 and $26 a test. So it's not a huge bargain. And a lot of them are subject to availability. So I did reach out to our vendor, McKesson, who we can purchase Abbott ID now, which is our PCR machine we use for town employees to keep our safe operations if they're symptomatic or a close contact. Those ID Now PCR test kits are all in back order and we're on allocation. So even our very small scale testing we're doing for municipal employees in the Burroughs region may be in jeopardy moving forward or rationed, as well as the state is still sending us the Abbott Binax now antigen kits for employees and other uses similar to schools. but those are also on allocation as well. So, I apologize to the public. Everybody's pinched. The public especially, is hearing of certain communities were given free test kits that they distributed. Northborough was not selected as part of that original distribution to the 102 communities. And we heard on the call with the state on Tuesday that nor do they expect that, there will be any additional allocations through that system. So now all municipalities are looking to purchase their own. And so that is a conversation. I was just on a webinar with the state where we provided additional information about that bid. But the concern is that a lot of the companies may choose to use their on back order. Their minimum quantities on the $5 test, you have to purchase a whole pallet. So you have to purchase $25,000 a kit. So there's discussions of possibly partnering with other communities. I also will be seeking Metro West Health Foundation grant funds to possibly look to purchase some of those test kits. But even with the purchase of the test kits, they don't go too far, unfortunately, and distribution is a problem. But we will, I'm committed to looking into it and to seeing what we can to provide to the public, especially to support the schools. Further to support, our housing authorities, our senior center and other things, but it's not free federal dollars that I could just drive to Boston and tell them to load us up and we're going to distribute them to the great residents of Northborough. It's really a choice. ARPA funding needs to get approved either by the town in some capacity. I can't independently or the board decide to use that ARPA funding. And so it's open to many things. So I think more to come on that, and we'll see where that need persists and how this process goes. That first meeting about those purchasing of at-home kits was today. And so I'm sure there'll be lots more discussion at the municipal level across the state. I do want to remind everybody that there are the Stop the Spread sites, but there's tips and tricks. So if you actually listen to Board of Health meetings, here's a good tip for you. I just, my in-laws, just experienced this today. So Marlborough Hospital, UMass is still running their Stop the Spread site at the New England Sports Center. If you get there, they open at 8. If you get there really early, you're guaranteed to get in. The trick is if you might be able to slide right in at 9 o'clock and not wait a whole hour. But my individual in my families that went today, they were closing down the site at 10 o'clock. And I understand they've done that all week. The site's supposed to be open from 8 to 10, but they're running out of kits. So I will be on the call with Assistant Commissioner Jana Ferguson with the state of Massachusetts tomorrow. And we're trying to talk to DPH about really where we are with the kits and local testing and the future of these Stop the Spread sites. So Ashland is having similar issues. The MBTA station that we've sent people to pour in the past, that has moved to appointment only. And when I looked earlier this week, you couldn't get an appointment in a week. And what a lot of people are saying, by the time I get tested, I probably won't test positive anymore. And I don't want to take a test from somebody else. So a lot of doctor's office, and I'm sure Swati, you can speak to this, they're even saying normally if you're symptomatic, pediatric offices will be able to get you in, but they're saying if you call and you have a home antigen kit and it went positive, assume you're positive and stay home because there's just not that capacity. So, best practices, the antigen kits have been extremely reliable for the most part, in terms of being, if it's positive, it's truly a positive. But it's also, the public needs to be aware that if your symptoms worsen, you might not test positive on an antigen at-home kit on your first day of symptoms. Sometimes it takes a day or two. PCR is a little more accurate at picking it up. And so more to come on that. I know CDC is talking about requiring, the antigen or a testing to get out early of isolation. It's a great idea, but again, limitation of test kits is something we're facing statewide, and it's really an issue. And unfortunately, I'm sad to report we don't have a solution, but we're continuing to look at it and how we can support the community.
Yep. Yeah, keep going. Wear your masks. You can get into the place in Marlborough. My wife went and she was there at about 7 a.m. and she was out about 8:30. So it's not terrible.
Yeah.
Moving along.
Yeah, they're doing over 4,000 tests a day over there, and they're running out.
They do a nice job over there. They really do.
And 9% positive, 39% positive rate. My wife is telling me this because she's on the Broad Institute
Yeah.
commission thing for Marlborough Hospital. So she's 39% positive rate out of all the tests that were done on Monday.
From Monday. And I
On
know
Monday.
Boylston Fire Department is doing for their residents some antigen testing. And yesterday of their 80 tests, they had over 50% positivity. And
So,
they've
yeah.
never seen anything over 10, 15. So things really are gonna change very quickly this week.
Yep.
Yeah,
We haven't hit peak until probably the 15th or the 20th of this month.
really?
Well, because again, you got to give it about 2 weeks, right, after the holidays,
Right.
after they get together. So let's assume January 1st and take 2 weeks from there. And that's what I think we'll hit peak at
29%,
39.
39.
39. Yeah. That's, that's a heck of a lot.
With the Delta, remember it was 5%. They shut the state down.
Yeah.
5.
Yeah. The only difference is this is not as, I mean, if you get it, it's not as serious. You don't get as sick, milder
Right.
symptoms compared to what Delta was, right? That's the only
Right.
trade-off. So, but I guess pick your poison.
Well, you still get sick.
You still get sick, yeah. And unfortunately, this one seems to be affecting the younger population much more than, the adult population. But
Yeah, and more people infected, it will mutate also.
yeah,
Some new mutation within US.
yeah.
Great. Well, onwards and upwards.
Yes.
Okay, is there any other business that should be brought before the board? Nope.
Just curious about those the 2 restaurants. I mean, all that's been in place, I take it. Because I know we didn't approve the minutes from last meeting, and I didn't know if that was part of this
I
meetings or
don't
not.
see it. I think we're gonna have to bring them up next time. But
Okay.
that's a good point.
Nope, I can just say briefly, I did check with our, health inspector, health agent Diane Legier, who was last out. She said that I did, when I posted the agenda, I said, Diane, do we need to have them back? How are things going? And she said they've been complying, they've made the changes, she's following along and was confident. So look for the independent, third-party reports. We'll forward those along to the board because that was a requested deliverable. But I know they both did, follow the timelines on working through that, and she's working with them closely.
Great.
So we are, nothing negative to report. It seems like things are there in place. So I don't think we'll necessarily bring it to the board unless, it was not to continue in a positive fashion. I will forward, ask that Diane forward any of those third-party independent reports to you for the reviews.
Okay.
Great.
And
they
let me
did,
know if you'd like it brought to the board at the next meeting.
and they did hire their consultants, right, for the time,
Correct.
so that we know.
Yes.
Okay. So you know who they
Yes.
are, so that's fine.
Yes, and they were
Great.
brought in very quickly and on time, so the 2
Perfect.
restaurants have
Good.
been fully
That's good to
compliant.
hear. Good to hear.
Very good. Well, I think that's it. We can establish a tentative future meeting date. It looks like February 8th, 2022. Unless something comes up, then we'll meet sooner.
Okay,
How's that?
that sounds good. And just for the board, I will take this order. We'll figure out how we'll do signatures if needed, officially hard copy or work through that with the town administrator's office. The order will be sent tomorrow to all businesses through the constant contact distribution list we've used all along. We will make sure it is posted on the town's website as well. If you have other ideas on how to help distribute through the community, please let me know. Our business listing is churches and, the full range. So, but if any of you are into social media, et cetera, we want to spread the word widely. I'll work with DPW. We do have the electronic signboard that I can request if DPW, post the storm could assist with maybe using that. I'm very envious of Westboro. Board of Health is doing a great job. They put up a very large billboard right away. So if you're driving on Route 9, take a look. They worked with a group. I don't think we have, the billboards on Route 9, but if there's other ideas, we want to help the community. We want to help our businesses comply. We're here as a partner. We'll make sure to produce signage that they could post, which is obviously a requirement. And we'll try to make it as easy as possible. But if there's ideas from the public or from the board on how we can help support businesses with this transition, please reach out to the health department.
Kristen, do you think if the school, because they reach out to so many families, if the school superintendent can?
I think that's a great idea. Actually, we'll be posting the information on our upcoming clinics. And
Right.
normally, Greg, the superintendent, is great to distribute. So we'll make sure that that's included, and we should probably have it all prepared as a PDF. So we'll distribute that, and the schools are a great partner. And I think that's a fabulous idea. Thank you.
And
Very
the other
good
thing is the billboard. Can't they just add in our name too? Like put in the town of Northborough next to
I was
Westborough.
thinking, just sneak Northborough in there too. Great idea.
It will save money. I don't know. That is,
Yeah, pay by the
public
letter.
health.
Pay by the amount of letters in Northborough.
I've got my Sharpie.
There you go, Glenn and the Sharpie.
North and West boroughs. So,
I think the DPW sign is a good idea because they get that right when you're coming in to downtown. So
and I
if
think
when
even
it's
the
available,
patch. I don't know if people read patch.
Mhm.
The
And also, I
online
can reach
version.
out to the community advocate is really, they've been a good source. So community advocate and Patch. Okay, those are great ideas.
well,
I know Patch did
also-
cover Grafton, in their sign. So, okay.
How about the record of the item? Which is like Clinton area.
Oh, I don't know that
And I
one.
was spending money.
Oh, well.
If we put it on the, it's required to be on the front of each
Each
store.
business, yep.
Right, each business. So the word will spread.
Oh, yeah. Within a week, it'll spread.
It'll spread. I hate
Okay.
using that term at this day and age.
Yep.
The word
Yeah.
will be passed.
Okay. And we'll make sure Diane was already speaking with some food establishments a lot, even, Walmart, they're all asking because they're seeing it happen. And
It's
so we'll
happening.
make sure we
It's
do.
happening in a lot of places. I mean, it's
Right. So we can distribute through food inspections, our relationship, and try to drop them off where possible. The shops are an easy stop,
Yeah.
for example.
okay.
And Kristen, can you send out the vaccine clinic information so that I can again give it to the nurses and?
Yes, most definitely.
Okay, great. Thank you.
Good. All right. Anything else? I move that nothing else. Then I move that we call the meeting to an end for tonight and pick this back up next month.
Second.
All those in favor?
Me.
Aye.
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 How about this? Delete
Aye.
Lisa,
Aye.
Teresa,
Aye.
and Swati.
Hi. Aye.
There we go. And myself. Very good. Thank you, everybody.
Thank you.
And stay safe out there.
Thank you.
Bye.
Thank you
Good
very
night.
much.
Aye.